Absolutely.
Thank you all for coming. In fact, I've sat on several committee meetings, and I'd say if there's anybody 19 to 39 or a parent and they'll have to watch a standing committee, that the 2 hours on this would be probably their most valuable time ever spent, getting a range from people dealing with them daily to the people who prescribe them, to the people who see the health emergency in British Columbia, to unfortunately the people at the end of life who see them die. This is probably the most profound panel I've seen on this issue. What I would like to know, and so I want to commend you first on that, Dr. Jerlink, if you can say what's your suggestions of the benefits of a supervised consumption service site in avoiding this opioid crisis?
Invaluable. People are always going to use drugs. Not everybody who has an addiction wants to keep using. Many of them want out, and they should be given the opportunity to get out. But it's simply a fact that people do not die in safe injection sites. And there should be, I agree with Sean, I mean, there should be one in every community in this country. And any barriers, as the barriers are there, and the wheels turn to try and get approval, I mean, people are dying in public bathrooms. Shouldn't be happening.
Dr. Henry, what's the percentage, do you think, in British Columbia that of the people dying from this opioid crisis are prescription-based addictions versus recreational-based addictions? Do we have any data even?
We don't have data on that, though I can say that the crisis in BC has evolved, and it's slightly different from what they're seeing in Ontario right now, where it's generally not prescription opioids that we're seeing as the issue. It's illicit opioids that are on that people are buying on the street. And so it may have started with some diversion of illicit fentanyl, but clearly the issues right now are around illicit fentanyl that's being manufactured mostly offshore and imported into BC.
And are there any detection devices if somebody went to a safe consumption site and wanted to test their product that they're using that can see the level of fentanyl or if it is laced? Is there any technology like that out there that would be helpful that we could have in places such as a safe consumption site where somebody can test their product real quickly to make sure they're not ODing on this afterwards?
So the short answer is kinda. There are ticket tests that we've done a pilot of at Insight that are they're like those pregnancy tests. There's little bars, and they tell you if it's, but they can only detect fentanyl, not some of the other illicit opioids that we're seeing out there, and we don't know how well they work. So this was just a pilot. Some of the challenges we're having is under the Controlled Drugs and Substances Act, the people who work at Insight cannot handle the drug. So the person themselves has to test their own drug, and it's a little bit tricky and complicated, and it needs some help. There are some machines, mass spectrometer machines, that can do a better job at detecting what is in substances, but again, they have to be used by somebody. And so that's where we think we can get helpful exemptions under the Controlled Substances Act to allow that service to be available more widely in places. So it is illegal for me to test your drug for you at the moment.
Great. Thank you, Randeep. Thank you. Okay.